Hi everybody, State Representative Jared Solomon here in Northeast Philadelphia at one of our fine community partners, the Philadelphia Protestant Home. They do so much great work in our community. Anthony Manzo here is the guy, the CEO, and we're talking about what's going on at the Protestant Home. Can you just, first of all, introduce yourself to folks throughout the Northeast?
Sure. As Jared said, my name is Anthony Manzo, and I am the president and CEO of this fine retirement community, CCRC, and I've been in that position since 2005.
So once you all got word about the spread, the quick spread of COVID-19, can you talk about the response from some of your residents? How did people feel? How did people start reacting?
Well, from the residents, of course, we have independent personal care and nursing facility residents here. The residents at first, well, we've been through things like this before. We've heard about all the different diseases through the years. I don't think any of us really appreciated the extent of what this was all about. So we had to immediately try our best to educate people, and it's a fluid process. We're getting information constantly. So one of the first things we did was go to our infection control protocols to make sure they were updated, make sure they addressed everything. Then we wanted to meet with all our independent living residents here, so that they could in turn speak to the floor reps could speak to everyone on the individual independent living floors, which there's 13 here, and just give them some general guidelines on hygiene, on safe practices, and the like, and also try to encourage them as much as possible early on to stay at PPH, because we have everything they need here, to limit their outside visits, whether it be medical visits, make sure they're essential medical visits, and just encourage them to lay low. And then as we learned, that didn't become a suggestion, that really became almost a mandate, because we certainly didn't want folks getting infected and walking throughout the buildings here on this campus. We also tell people to really, there's actually no visitation at this point, other than some of the folks who are at end of life. Of course, we're going to be compassionate and understanding for family members to come in and visit with their loved ones at the end of their life. But other than that, I mean, that's really the extent of the visitation. We're doing temperature checks. We're asking the appropriate questions. We only have 2 entrances open at this point in time. And those of you who know PPH, I know you do, Jared, there's a lot of different ways to enter and exit PPH. We're now confined to 2 entrances here. So, there's some of the things we've been working on. We have a team made up of the leadership, made up of our department directors, our infection control people, our medical director, our medical staff, who meet regularly to sort of reassess where we are, answer questions. There's always some new little wrinkles that come along we have to deal with, and just try to keep everybody up to date on all that's happening. As I said earlier, things are changing by the hour. So we rely on the Centers for Disease Control and Prevention. We rely on our Pennsylvania Department of Health, our City Department of Health, our governor, our leaders, and we're just trying to do the best we can. It's not a 100% Loctite. I don't think anybody could say that they were at that point. But the more we learn, the more we try to tighten everything up. I think we're doing all we can to protect our residents, our staff, and some of the other people who do come into the building, which, as I said, are very few.
And thank you so much for all you do. As Anthony mentioned, it's really important, right? We're practicing the social distancing here. When I came to drop off some hand sanitizers to the good folks at PPH, like Bill Conaway and Anthony, did not go in the building. So it's so good that you basically taken the lead from our governor, from the CDC. You've put the necessary health precautions in place. Anything that the community can do in our area to support the work that you guys are doing here?
Oh, that's a good question. Some of the things that really concern me are the availability of supplies, protective equipment, and that sort of thing. So people who are rushing to stores and buying in bulk some of the items, I don't think there's going to be an issue, at least from what I'm hearing. I think the stores will be replenished on a weekly basis. Folks are honoring our visitation policy right now. I encourage that to continue. I understand it's hard People want to see their loved ones. They want to be around their loved ones. And I just think everybody in the community needs to really sort of sit back and say, look, I know this isn't easy. I know I want to get out there and I want to do things, but for the time being, you're going to do all of us a benefit if you do stay out in interactive situations. And as you said, do the social distancing, do all that sort of thing. So everybody has to cooperate here. And I know some of the younger people are feeling, well, we're invincible, like a lot of us do when we're in our 20s and 30s. The fact of the matter is, you can still get infected, and you can pass those infections on to more vulnerable population, like seniors and others, and people who have certain medical conditions. So don't only think of yourself. Someone put it really well this morning when I was listening to the news coming in, is we should all act as if we are infected and take the lead from that.
Take the necessary
Exactly.
precautions.
Yeah, act as if we're infected and do everything we can, all the precautions to try not to give it to someone else. So.
Thank you, Anthony. If you do know someone at the Protestant home, even though you can't come, please reach out. Send an email, send a letter, pick up the phone and say hello. Surround folks here with warmth and good wishes, which is really what we all need to be doing. Anthony, thank you so much. It's great to be with you at PPH, and let's continue to work together. Thanks, everybody.